Welcome to this Memorial Day weekend edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together for you to understand the conservative life, the libertarian life, and what was set forth by our founders and paid for by those who gave the ultimate sacrifice that we remember this weekend. We've got a great program cooking for you, and one of our good friends, Vice President of the National Center for Public Policy Research, is on the phone with us to kick it off. David Almasi. David, welcome back to Freedom and Prosperity Radio. How are you doing, sir?
Doing great. Glad to be here.
Now, you guys have been chasing around, and I'll tell you, you and Justin and all the folks there do such a great job of getting on every board. You guys must own at least some shares in every publicly traded company out there because you are chasing them down. You get into these board meetings, you get into these shareholder meetings, and you really try to hold some of these corporations to account for some of their bad behavior, and I really appreciate what you do with it. Now, you guys went after CVS, the pharmacy chain, about healthcare rationing, and I don't think a lot of people realize how big a role these pharmacies have started playing in healthcare, especially since the Patient Protection and Affordable Care Act. I'll pause for everyone to finish chuckling about the name. Has been put into effect. So talk about what you found and then what you did with them.
Well, that's the unfortunate thing is the Obamacare, we'll call it by the short name, had the death panel in it. That was the way that the government could look at ways to minimize its costs by essentially rationing care. And that was highly unpopular, considered to be illegal, and was never actually became part of the Obamacare structure that we see today. However, we're seeing this on the private scale, private side, with CVS and other healthcare companies working with a group called the Institute for Clinical and Economic Review, called ICER, which has been pushing the idea of saving costs by keeping some people from being able to get care because they're considered to be too much of a risk.
It goes back to, sort of the Stockholm syndrome we've put ourselves in. We've allowed behaviors at the payment level to separate the patient from the doctor with all these second, third, fourth, fifth parties in the middle of it. And then they start having bean counters watching over it. I hope at some point we get back to a place where it's just, hey, doc, how much will it cost for you to take a look at my shoulder? And we can get back to a real consumer marketplace. So what was CVS's response to this when you guys held their feet to it?
Well, what we've done with CVS and with Johnson & Johnson, and we plan to do with other companies, is ask them why they're going to hang out with this group. Mm-hmm. Now, this group was founded by a guy named Dr. Stephen Pearson, who comes to our shores from the United Kingdom, where he was affiliated with a group called the National Institute for Healthcare and Excellence, which translates into NICE. But as we've always told these CEOs, it's not NICE. That is one of the groups that pushed the rationing over there in their National Health Service and has gotten great things to happen over there, like people going blind from cataracts just because they have to wait so long. People that don't get the diagnostic tests that they need within a fair amount of time to really be able to meet their needs and treat their medical problems. And we've asked these people, like, hey, what are you doing hanging out with this group? Why are you a member of this organization? Why are you funding their conferences and things like that? And in the case of Johnson & Johnson that I went to, I got a look of horror from the CEO because he didn't realize that this kind of thing was out there. And CVS tried to play it off, saying that they wanted to try and drive down drug prices. Now, to tell a little story about the way, our thing is ICER does nothing to control drug prices. ICER doesn't make drugs. ICER doesn't develop drugs. ICER doesn't market drugs. They just sit there in their ivory tower and tell people what should be done.
Right.
In the industry, I'm going to use the example of hepatitis C, liver disease. That it used to be a couple of years ago when you got it, you got it for life. There was no cure whatsoever. And then along came, it was the drug maker Gilead. Gilead came up with a drug called Harvoni. Very expensive, very intricate, very precise. You had to take drugs at a certain time every day for, I think it was 3 months. Very, very intensive, but it cured hepatitis C, something that could never be cured before. But it was something that the industry and the healthcare people said, this is really expensive. $80,000 for this treatment is it's beyond our limits. And that's the kind of thing that ICER will latch onto and say, we need to make sure that the people who get this drug are going to be the best possible people, the ones we can trust. But if there's someone older or sicker or someone like that, we might deny them. But the thing is,
chilling.
In the time since Harvoni was introduced, it now has competition. Another drug company, AbbVie, has another drug, competing one called Mariette, and it's cheaper. And I don't know if it's any easier to take or any less detailed in the way that you have the treatment. But the industry itself found a way to make drugs cheaper and more available to the public. It didn't have anything to do with ICER, and in some ways didn't have anything to do with these other companies that are involved in helping fund ICER.
Well, let me ask you this, David, and this strikes me as odd in all of these cases. You're bringing up hepatitis C, but we see this in some blood pressure medication that somebody says, this drug is $100 a pill. And if you pencil out the cost, certainly compare it to other medicines. But when you compare it to the way we would have to treat hepatitis C in years gone by, or perhaps kidney failure with dialysis, and we don't compare the cost of the medicine that was created by a pharmaceutical company with the cost of, in most cases, a surgical procedure, long rehab, and perhaps permanent disability from what these medicines are treating.
That's true, and we also don't look at the fact that these companies sometimes charge the amount that they charge because they need to get back the tremendous costs that it takes to make these drugs.
Sure.
I've been to the one I remember was going to Eli Lilly a couple years ago and seeing the board where they had all of the different medications they were trying to develop for diabetes, for high blood pressure, for other major health problems. And the majority of those drugs were failures. I mean, someone's got to put the money up to do all this stuff. It's not, they may end up being able to make the drug out of very cheap products. I mean, you can make a potentially an AIDS drug out of candle wax and use chewing gum. But the thing is, getting to that point that you find it could cost billions and billions of dollars. Johnson & Johnson spent $10 billion last year trying to develop new drugs. Most of that, I think, was probably wasted away on good ideas that just didn't pan out. So we need to understand that, and we also need to understand when these other countries have cheaper versions of the drug than us, they're strong-arming those companies to give them those drugs for cheaper, whereas here we let the free market decide, and those other countries are free riders for the most part on what we're doing here. The great advances come from America. They don't come from Spain or England for the most part.
David Almasi is on with us. He is the Vice President of the National Center for Public Policy Research, and he's in their Defenders of Property Rights and People First Accuracy in Academia programs. Nationalcenter.org is their website. It's great. Never mind the Adjunct Project 21 as well, and the work you guys do there. I remember, bless their little arrogant heart, when now I'm trying to remember the economist that went on ABC, Krugman. and admitted that, oh, we don't call them death panels, but these advisory and care panels, I mean, of course you just can't give everyone. It's chilling to think that you've got a board or a commission or a group that's going to determine the value of somebody's life. And I know that there's simple fixes for it. Just health savings accounts alone allow somebody to save for their whole lives, not just for a limited period of time. A little bit of money every month that they would have given to a health insurance company, and save it so that when they need a treatment like this, they're not worried about CVS or somebody else saying, yeah, no, we decided you've only got a few years of tax paying left, which is really, at the end, David, is it not fair to say that this is what they're going to judge? How many more years of tax generation you're going to do for us, and so there it doesn't pencil out for us to give you health care?
Yeah, I mean, they measure it on like quality of life years, and obviously I'm sure the taxpayers are in there somewhere, but it's someone else saying what the value of your life is. And if you're older or you're sicker, you're going to end up on the back end of that scale. And that's not right. That's not fair. And that's really kind of creepy, if you ask me. And it's something that I hate to think that our healthcare infrastructure is the one pushing it.
Well, and it's certainly not something I want the government involved in, but I also want to be able to make that decision with my family. I don't want CVS or anyone else. Talk about the roles of these chains and what we're seeing is a real interesting model. It's the First Med chains, and CVS is even getting involved in, these non-hospital medical care facilities. Is this good or bad? Because I think in terms of pharmaceuticals, if you want to drive down costs, maybe make those patents not last so long, or maybe try to lift some of the burden of getting the product to market. That seems to be a big problem with a lot of these experimental treatments, is it takes so much more, even after they're proven to be effective, to get them into the American market anyway. There seem to be a lot of simple things that won't cost us anything because they're built on not doing something anymore.
Yeah, I'll address that one first, that second part first, which is we did have legislation passed during this, I think it was the last session of Congress, making it that you can, patients can try. They can have a right to try.
Right, that was very important.
That's still in the trial process. Because if you're dying, if you're considered to be terminal or close to terminal, why not take a drug and be a test subject? Why not be the guinea pig? If you die, well, you are going to die. If it fixes the problem, hey, that's great. And not only will you help yourself, but you'll be helping other people.
Exactly.
As far as the economics of everything in the whole care industry, you're seeing a lot of companies merging in the process, and you've got providers and pharmaceuticals, insurers and providers. They're all kind of getting into the same kind of. They're all kind of becoming the same thing these days. And so we're kind of we're not sure how the future is going to be. But I went to Humana earlier, and this is another good example. Humana, the chairman was saying nice things about Medicare for all. And it's like, wait a minute, you're an insurance company. Medicare for all in Section 107 says you don't get to exist. But Humana also has a provider section. So we're trying to think, like, what is this guy doing other than thinking, well, maybe I can get a leg up on the competition.
Right.
Maybe we won't be offering insurance anymore, but we've got contracts with Medicare, we've got contracts with TRICARE and Medicare Advantage, and we can survive that way. And I'd rather they think about my survival than their own survival.
But the bean counters are what you're talking about, is they'll sit there and say, well, you know what? Okay, so we're not in the insurance business anymore. That cost us a lot of money. That was a high overhead part of our business. It's much easier to make a profit if we're just on the provider side. I can certainly see that penciling out, not really knowing a lot about the insides of it. David Almasi in National Center for Public Policy Research on this week's Freedom and Prosperity Radio. Where do you think we're going? You mentioned the right to try laws, which was a big step forward, but it's only the first of what I think need to be many steps. We've heard less and less about repeal and replace. It's gotten lost in the subtext. Where do you think we're going next with healthcare, or is, just, pardon the phrase, the new normal? This is what is Obamacare.
I think there is, to some degree, a new normal, but we're also in a big wait-and-see area because, as we conservatives always warned, Obamacare was never going to succeed. Obamacare was just the way to get the foot in the door. It would collapse, and then you'd have people demanding single-payer, government health care, Medicare for all, and that's where we are right now, where in 2020, there could be a change in administrations. There could be a strengthening of liberals in the legislature. And if that's the case, we could be jumping a whole lot closer to government health care, if not going in with both feet. And I think the healthcare industry, minus Humana, it seems, has figured that out, and they are fighting. They are pushing back this time. They gave in for Obamacare, but I think they realized that they're in an existential threat right now, and they need to be involved on the side of free enterprise and liberty. So I think we're kind of in a wait and see until 2021 when the dust settles and we see what the government looks like.
Wouldn't it be sadly ironic, though probably all too typical, David, that Paul Ryan and the Republican Congress in their inability to do repeal and replace actually led to the demise of the Republican brand and the ascension of somebody like Bernie Sanders and the idea of Medicare for all, just by allowing Obamacare to stay there and accomplish what it was set out to do, which is crash the medical system.
Yeah, I think the conservatives in the Congress, one of the worst mistakes they had was not having something there to replace it, not having a coherent free market alternative from day one. And when they didn't have anything to put up there,
you open up a quick can of worms, and just it's one of those things that I love the smell of facepalm in the morning is one of the alliterative sayings. But how could, after all that time, 10 years in the wilderness, how could nobody say, hey, I got an idea here? Or let's call Dave Almasi at the National Center or any of the other think tanks that had come along, with plans, Sally Pipes at Pacific Research, certainly Heritage. Any number of you groups had plans and agenda points and held seminars with some members of Congress. Nobody could reach out to you. Was it arrogance that said, we can't allow these folks to be seen as influencing us? Or did they really just not want to change this because the Chamber of Commerce has cut a big check for them and they think it's a way of saving their businesses money?
I don't really know how to answer that question other than just saying it's the typical congressional just not getting to the root of things, not actually giving us a solution right away and just moving the ball around the field.
Yeah. And
you're right. You're absolutely right, though. They should have reached out to us. They should have found ways that we could work together on getting something done so that, as I said, on day one of the Trump administration, there would be something that people could latch on to, they could point to, rather than just saying, we're going to repeal and replace. And when they say, well, what are you going to replace it with? And they're like,
aha.
I don't know. We'll figure that out when we come along. Get there.
Well, it was as bad as we'll read it when we pass it in the first place. And that's why, part and parcel of why I think the president had to work so Herculeanly just to hold on to the Senate. Because if he had just behaved like a normal president heading to the midterms, I think you're looking at Chuck Schumer running the Senate and Nancy Pelosi running the House. And we're in a whole different conversation, David.
Yeah. And when the year and a half that I worked in the healthcare industry, my boss, who was involved in the first Obamacare or the Hillary Care battle, actually, she would say to people now, you can't break these companies that we have here. You can't break our healthcare system. You can't break our drug companies, because if you break them, they're not going to come back. We can't go look to our friends across the ocean for support because they've already broken their system.
Right.
They don't know how to put it back together. We're it.
And it's the classic Reagan line, once this city on the hill is gone, there isn't another one on the next hill. So we've got to...
Exactly.
I mean, Mick Jagger, he's back on tour a couple of weeks after having open heart surgery, but he had to have it in the United States despite being, I think, knighted by the Queen. Maybe he has to give that back now.
Yeah, no, my mother-in-law had a heart attack 2 weeks ago. She called us at 11 o'clock, said she was having chest pains. By 2:30 in the morning, she had a new stent in. And I don't think, we know that you don't get that kind of service in other countries.
Yeah.
That's just, she's here because of our system, and I don't want to see that change.
And yours is so common a story, David. Thank you for taking time out with us. What's next for the National Center for Public Policy Research? Where are you headed to next? Which shareholder meetings are you going to show up at?
Well, in just a couple of minutes after this interview ends, I'm going to be getting on a plane to Chicago for United Airlines and J.P. Morgan Chase. But we have a full schedule of shareholder meetings through June and later. A big thing is board diversity. We're asking boards to look at having conservative candidates on their boards rather than just a monolithic liberal thing, or what the left wants to do. They want to stack the boards by race and gender. We think it's a good idea to have people that think differently rather than just look differently.
Go figure where that would work. Why would a company want to do that, David? Well, thank you, sir.
Exactly.
Again, it's nationalcenter.org, and thank you for joining us this week on Freedom and Prosperity Radio.
Anytime. Thank you.
Travel safely. Memorial Day weekend special continues with the folks in Tidewater, and they know a thing or two about the sacrifices made. But Robert Dean, chairman of the Tidewater Libertarian Party, it's a tough place when the good news for a Republican candidate for Congress is that he didn't specifically corrupt the voting system. Well, that's good news, but some of his minions did. We'll get into some of that coming up next on Freedom and Prosperity Radio.